All right, well, good morning, good people. I am Councilmember Gabe Albornoz and chair of our county's Health and Human Services Committee, and it is a privilege and honor to be here this morning with all of you. I want to take you back in time to April 2019. It's about a month after the first few positive test cases of COVID here in Montgomery County. Things were chaotic, crazy. Our procurement director was contacting random contacts in South Korea and China, trying to procure surgical masks and basic supplies that we were trying to get a handle on. We didn't know what we were dealing with, and that was when the governor said that we were in a state of emergency and everything shut down for almost 3 weeks. Nobody could go anywhere. During that time, a neighbor and friend, Maura McCarthy, was about to celebrate a very big milestone birthday with her family. Maura was also a nurse at the ICU at Suburban Hospital, and that morning she got the call from her boss that she was needed to come in on an emergency basis because their hospital had been completely, as all hospitals at that time, overwhelmed. So she left her family and was about to do a 12, and later we would find out 24-hour shift at Suburban. But before she left, her husband, Bob, sent out a text message to a handful of us who lived right by their home, asking us to come out, bring some signs, and cheer on Maura as she was going to report for work later that afternoon. Well, somebody in that text message posted that on our listserv, who posted it on another listserv, who posted it on another listserv. And a couple of hours later, every single neighbor surrounding their home stood outside in front of their house with signs. But it wasn't just them. People from neighboring jurisdictions came over as well. I've been to the Nationals parade, I've been to presidential parades, and they didn't hold a candle to the emotion that we were feeling that morning. Recognizing an incredible leader in our community, an unsung hero in our community, who was leaving her family to help take care of all of us. Public Health Month reminds us that these unsung heroes who every day train and work their butts off to get to where they are to take care of all of us. During those months, we didn't take for granted public health. We recognized how acutely important it is to all of our lives, and we also didn't take for granted the medical professionals who every day keep us safe, keep us well, and take care of us in our greatest hour of need. So this month, let's remember and try to forget some of those moments, but remember the times where we do recognize these professionals and also recognize that, for God's sakes, public health cannot be a political football. Science is what must rule the day, not some random person posting inaccurate, random information that's preying upon our fears and anxieties. Our public health professionals are extraordinary, and we have to uplift their work. We have to support their work at every conceivable level. And here in Montgomery County, we know that. And we are blessed to have the best of the best among us, many of which are represented behind me today, but many of which are in our community and in our region. So thank you all for being here today as we celebrate Public Health Awareness Month and once again uplift their sacrifice and dedication. Now, our county executive.
I guess it's logical that we all pivot to COVID because it's probably like our greatest experience is the importance of public health. Public health does their job every day, and they deal with a myriad of problems in the community every day. But COVID kind of showed you what this was all about, and the amount of dedication that people put into that. I had the opportunities to visit hospitals during COVID and to see, emergency rooms overwhelmed and doctors struggling to deal with patients, and all of these people going to work every day when everybody else was Zooming, and you can't Zoom this job in. If you're not there, you're not there, and you're not helping. And these folks showed up every day. Nobody said, this is too dangerous for me to go to work, I'm not doing this. People were there no matter how dangerous it was, and they recognized how important it was. Montgomery County was able to find supplies. We did scour every portion of the universe. We got large shipments from China of masks. I did a video at home on how to make your own mask. I cut up one of my T-shirts and turned it into a mask, and I found that it had lots of views, and people were doing the same thing. The county actually sold at what we paid for materials, masks, and gowns to hospitals during this, and not only hospitals in our county, but outside our county, because we had managed to get a supply that other people didn't have. And I think one of the things we learned out of this, we went into it without a supply of masks and gowns. Whoever thought you would need a supply of masks and gowns, we understand you probably ought to have a supply of masks and gowns. It takes a while to scale up and be able to get everything you need. And we saw the pain of scaling up. If people didn't respect health professionals before that, they have to respect them after that, because you could see the pain and the tribulations that people had when they were going through work. This was not easy to be dealing with this. It was hard, particularly in the beginning, to maintain the kind of protection that people knew they needed, and yet they persisted in what they did. And I think, we're stronger for it. And I will, reiterate what Gabe said about having somebody at the highest level who does not take public health seriously, who thinks you can take vitamin A for everything. This is not the way the health system of this country ought to run. It's not the way it's run historically. It's been fact-based. It's been delivery of service-based. It is not hope that people will get better if you take some magical formula. We had a president who suggested bleach. That would have been nice. It's just the work these people do is too important and too valuable, and it needs to be taken seriously. And people who occupy positions overseeing this need to take the work seriously and cannot pretend that there are magical solutions. This shouldn't be an ideological thing. There's no left and right on healthcare. Disease is disease, cures are cures, and politics should not have a damn thing to do with how we deal with healthcare. So I'm happy we're here today to honor all the professionals that do this work. You made people's lives in this county a lot easier than it would have been, and none of us here, and I remind people this all the time, the county gets a lot of credit for stuff we do, and all that stuff we do is done by other people. It's done by nurses, it's done by doctors, it's done by our social workers, it's done by all the people who work for the county. We provide money, they do the work, and without them, the county wouldn't look the way it is, and we wouldn't feel about the county the way we do. So happy to be here this morning.
So on a much lighter note, although it was an important time, I'll note that the T-shirt that the county executive cut up was not one of his Bruce Springsteen T-shirts. That's true. All right, we're going to have everybody introduce themselves quickly and their titles, and then we're going to hear from Dr. Ashford.
All right. Good morning, Dr. Nina Ashford, Chief of Public Health Services at the Department of Health and Human Services.
Good morning, Becca Orgesa, Senior Administrator for School Health Services in HHS.
Good morning, Dr. Patrice McGee, the Chief of Aging and Disability Services within the Department of Health and Human Services.
Hi, everyone. Miriam. I am the Community Engagement Manager for the Latino Health Initiative.
Good morning, everyone. Dr. James Bridgers, the Director of the Department of Health and Human Services, and I will save my stories for later.
Good morning, Mariana Serrani, Manager of the Latino Health Initiative at the Department of Health and Human Services.
Good morning, Kim Mayo, Administrator for Community Support Network and Aging and Disability Service in the Department of Health and Human Services.
Thank you. Now we will hear from Dr. Nina Ashford.
All right. Thank you, HHS Chair Albornoz. Thank you, Mr. County Executive, for recognizing Public Health Month. While I am one person standing here, I represent the Public Health Services service area, which is over 600 dedicated employees. But we are part of an integrated health department led by our fearless leader, Dr. Bridgers, of over 2,000 employees. And I'm joined here by my colleagues across the agency because the fact that we are integrated is one of our superpowers. And it is an honor and a privilege to get to do this work every day. As you heard, when public health works well, you often don't even know that we're here, right? And so we tend to be the unsung heroes behind the scenes, keeping the trains running, keeping the community safe. And I wanted to take a moment and just toot the horn of the incredible work that our team does. So we start at the beginning of the lifespan. Our maternal and child health teams, they are screening the newly enrolled Medicaid patients, moms and their babies, to connect them to our services. We see over 1,600 moms and babies every year providing in-home visitation and case management, as well as programs focused specifically on our Black and African American moms as well. Our school, it's okay. Our school health services team, led by Becca Urgesa behind me, we have nurses and health room techs in all 211 elementary, middle, and high schools across the country, across the county, 163,000 students. And because we have health rooms in schools, 78% of kids that came to visit a health room were able to return back to class, which means that kids are staying in school, getting education. They don't have to leave. They don't have to get picked up. They don't have to go to a doctor. They can continue to focus on their education, which is why they're there. If you have enjoyed a restaurant or a spa day with your girlfriends, or a local swimming pool, or your kid goes to camp, those are all safe because our environmental health specialists are literally out here every day ensuring that those organizations and entities are in compliance with COMAR and the state regulations, partnering with our business community to make sure that these facilities are safe for our residents. Our community and population health team, our mobile health clinic team has seen over 1,000 patients, clients across the county who might not be able to make it to a healthcare facility. They are taking services out into the community where we live. They provide primary care access to over 25,000 uninsured individuals to over 12,000 uninsured children in this county. Dental services to 6,000 individuals every single year that might not be able to afford dental care. And last but not least, our Dennis Avenue Health Center team that is doing all of our immunizations, our infectious disease tracking. I think you guys have probably heard measles has been in the news, right? Any infectious disease that pops up, our contact tracers and our team is on it. Bird flu, our tuberculosis clinic, our sexual health and wellness teams, our public health emergency preparedness teams who are literally preparing, God forbid it doesn't happen, but the next disaster. So if it does, we will be ready. We were just at a tabletop exercise last week where we were preparing for a potential radiological event, because the time to get ready is not when the event happens. We make sure that we do all of the planning in place beforehand. And then, of course, our health planning and EPI team, which provides the data to fuel our work. So that is just a snapshot of what the team, and I could probably talk here for the next 3 hours about everything that we do. I'm so proud of our team, of what we do every day to keep our residents safe. You know, last Tuesday, for those of us in public health, we kind of viewed it as Public Health D-Day. That is when we saw the dismantling of our public health systems at the federal level. It was a heartbreaking day, and seeing the fallout of those decisions at the federal level has been unimaginable. One of the priority areas for Public Health Week is it starts here. Your health is our mission. And that is more important now more than ever. Regardless of, and we need our federal partners, so I'm not saying that that's not important. And I also want to acknowledge we have a lot of Montgomery County residents who are public health heroes, who are public health champions that now find themselves, okay? And while we are watching this happen, it starts here, your health is our mission, as a reminder that Montgomery County will continue to show up. We will continue to protect the health of our public. We will continue to follow the science. We will continue to focus on eliminating disparities. We will continue to focus on achieving health equity. We will continue to focus on supporting our residents and keeping our community safe, our children safe. It is an honor to get to do this work every day. It is an honor of a lifetime to be able to represent this amazing team and this fantastic department. And I appreciate the opportunity to speak with you all today. Thank you.
Thank you, Dr. Ashford. All right, the county executive and I will now read the proclamation. The County Council of Montgomery County, Maryland, hereby proclaims, whereas this year marks the 30th anniversary of National Public Health Week, and the 2025 theme, It Starts Here, highlights the importance of public health that starts with each of us, focused on making a difference in our homes and communities, and
Whereas science is the foundation of public health, providing evidence-based methods to understand diseases, develop effective interventions, and shape health and policies. And
whereas the Centers for Disease Control and Prevention defines public health as the science of protecting and improving the health of people and communities by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. And
whereas, according to the CDC, healthcare access, education, economic stability, and community are essential social determinants of health, encompassing physical well-being and psychological wellness, with mental health being fundamental to overall well-being. And
whereas, while Montgomery County is recognized as one of the healthiest counties in Maryland and the United States, we continue to prioritize health equity and work to eliminate health disparities. And
whereas, while Montgomery County is recognized as one of the healthiest counties in Maryland and in the United States, we continue to prioritize health equity and work to eliminate health disparities. And
whereas the COVID-19 pandemic demonstrated our public health infrastructure is critically important, prioritizing continued investments as well as essential services and resilient systems. And whereas current massive cuts to our federal workforce are relentless and our relentless assault on evidence-based health interventions and methods, and a threat to the progress we have made in tracking outbreaks, developing vaccines, and implementing effective public health measures. Now, therefore, be resolved that the County Executive Mark Elrich, and the entire County Council of Montgomery County do hereby proclaim April 7th through April 13th, 2025 as National Public Health Week, and calls on all residents to observe this week by recognizing our public health professionals for their dedicated service in addressing public health challenges facing our community. Presented on this 8th day of April in the year 2025, signed by the County Executive and our Council President.